Bangladesh has been hit by one of its worst dengue outbreaks in years. More than 300 people have died as a result. The disease is primarily transmitted through mosquitoes, and in Bangladesh, August and September count as peak season. However, this season has lately extended to November, partly due to warming temperatures caused by climate change.
For days, Wasfia has had a high fever. She's too weak to get out of bed and struggles to keep any food down. The 8-year-old recently contracted dengue fever and is being cared for by her mother Suraya at home.
Basically, all of my family have dengue fever. My brother has it and my stepsister. She's doing very badly right now. My father has it too. They've all tested positive for the virus.
Dengue fever is carried by mosquitoes. In people, it causes a high temperature, muscle and joint pain, and can be deadly. Bangladesh's hospitals, like this one in the capital Dhaka, can't cope with the influx of patients. Many are sent home.
It has becoming a huge problem for Bangladesh. It has actually become an epidemic, and it has surpassed all the records of the past, both in terms of cases and in terms of deaths.
Experts cite several reasons for the spread of the virus. Standing water combined with summer heat allows the mosquito carriers to breed particularly quickly. Many people can't afford anti-mosquito protection. And then there's climate change too.
Temperature is not coming down even in December, so a little bit raised temperature that is required for the breeding. So it has become favorable, especially in Bangladesh region, that the season has expanded.
The Akhtar family lives in a district of Dhaka which has been designated a red zone. There are particularly high incidences of the fever here. It's likely that Wasfia's mother Suraya will also get it.
I'm not afraid of dengue fever. Anyway, if I get it, there's nothing I can do about it. But I am worried about my children. Who will look after them if I, their mother, get sick?
She prays every day that she won't get infected and can stay healthy for the sake of her children.
A deadly outbreak made worse by climate change. For more, we have DW reporter Minka Kerr joining us in the studio. Minka, welcome. What's the connection with climate change here?
Well, as we heard in the report, the mosquito season is actually getting longer, potentially by several months, thanks to climate change. So monsoon flooding in Bangladesh is expected to get worse, and this means that there'll be more water around for mosquitoes to breed in. Another factor is higher temperatures. So higher temperatures mean that mosquitoes can actually reproduce faster, and they can also live for longer. And additionally to this, it also benefits the actual dengue virus itself. The virus is able to speed up its incubation period, so it can mature faster and then more quickly infect people. And the last thing to consider with higher temperatures is they're going up around the world, right? So areas that have never had these mosquitoes before now do. We're seeing them appear in temperate parts of China. They're also moving further north through North America and also through Europe. We've seen them as high up as the UK. So potentially over time, millions, if not billions, more people will be exposed to the dengue virus. And the World Health Organization has said that this outbreak and outbreaks like it is a canary in the coal mine of the climate crisis.
So mosquitoes appear to be the real winners when it comes to climate change, don't they?
I mean, it does look like that, but temperatures may actually go up too high even for mosquitoes. So the particular species of mosquito that carries the dengue virus is very temperature sensitive. It prefers a range of about 20 to 30 degrees Celsius. So if average temperatures go up beyond that, it may negatively impact their populations too. But keep in mind that mosquitoes are highly adaptable creatures. They've evolved in the past to be able to cope with changing conditions. They're now able to thrive in urban environments. They've also developed resistance to certain insecticides, and so they may be able to adapt again to the changing climate.
So what is being done to tackle this current and ever-growing threat?
Well, unfortunately, there's no cure for dengue fever and there's no widely available treatment or vaccine. So most strategies revolve around stopping infected mosquitoes from spreading. So some of those strategies are draining or protecting still water sources and also fumigating with insecticides to kill the adults. In Bangladesh, though, the government has been heavily criticised for its response to this outbreak. They've been accused of only acting once cases are already spiking and for not having a clear plan despite outbreaks now being a common occurrence in Bangladesh. And one example of this is the Mosquito Control Department in Bangladesh's capital, Dhaka. They've been accused of leaving empty drums that housed insecticide lying around their building, and these drums have now filled with water and become breeding grounds themselves for mosquitoes. So there's a lot of anger there. In terms of international action, the World Bank has approved a $200 million loan for primary healthcare across the country. But the wider issue here is combating climate change. Bangladesh only contributes 0.4% of global greenhouse gas emissions. But they're still heavily affected by climate change. And so the wider issue is lowering greenhouse gas emissions globally to help prevent outbreaks of this scale from happening.
We'll leave it there for the time being, but thanks so much for coming into the studio and breaking that down for us, Minka Kerr.